What is projection for Saline breast implants? Imagine how a breast looks from the side. Projection is all about how the implant pushes the breast outward from the chest wall. It's a big part of shaping the overall look after breast augmentation. When surgeons talk about projection for Saline implants, they mean how much the breast will stick out after the implant is placed and filled with sterile saline solution. Because saline is a fluid under pressure, these implants tend to have a higher projection compared to silicone implants of the same size. That means a saline implant with medium projection can look similar to a silicone implant with a high projection. Saline implants usually come in different projection options, from low to high, so patients and surgeons can choose how much the breast will project forward. However, compared to silicone implants, saline options are a bit more limited in the range of projection profiles. The projection affects the side view of the breast and how much the implant pushes the tissue forward. When planning surgery, surgeons consider projection along with the size, shape, and placement of the implant to achieve the desired look. It's important to remember that projection is just one piece of the puzzle. The final shape also depends on the elasticity and quality of the patient's skin, whether the implant is placed above or below the muscle, and the overall size chosen. Because saline implants are filled after they are inserted, surgeons can sometimes adjust the volume during surgery to fine-tune the projection and the overall appearance. In summary, projection describes how an implant extends outward from the chest wall, shaping the breast's profile. Saline implants tend to have higher projection than silicone implants of the same size because of how they are filled. They offer options from low to high projection, but with less variety than silicone. The final look depends on the projection, the size of the implant, placement, and the natural tissue of the patient. Surgeons can tweak the volume during surgery to help meet the patient's aesthetic goals. Understanding projection helps patients and surgeons choose the right implant profile to achieve a natural or more dramatic look, all while considering the unique properties of saline implants in breast augmentation. Always consult with a qualified plastic surgeon to discuss your individual needs and goals.